Hello, everyone. This is Cole from the American Journal of Healthcare Strategy. We're joined by a very special guest, Alyssa Scully, the AVP of Operations with the Northwell Physician Group. Alyssa, please introduce yourself.
Good afternoon. Thanks again for providing this unique and special opportunity to share today. My name is Alyssa Scully, and as you said, I'm the AVP of Operations for Northwell Health Physician Partners. We're the employed medical group practice of Northwell Health and happen to be of the largest groups in the New York region, about 4,800 physicians practicing across a pretty expansive geography, 780 ambulatory locations, 19 hospitals, and several affiliate hospitals.
We're so excited to have you on because Northwell is very well known across the country as one of the kind of premier and leading institutions. And also, your role is expansive. As you mentioned, that's a huge amount of locations and hospitals and physicians that you're working alongside there. What kind of services are being offered across Northwell with their physician group?
Sure. As you know, Northwell Health, we're really more than just a health system. In addition to offering sort of the full healthcare continuum, we do have a large education and research mission. We have population health, community health, and a for profit entity that really helps inform our major part of our impact. Your readers, as you mentioned, probably have heard about Northwell's growth and expansion over the last decade, and we'll continue to do that. It's really in response to our mission to care and provide the right composition of services based on the needs of our region. Our goals are always to enhance their own professional experiences. And in short, we like to say that our goal is to make Northwell Health the best place to work for doctors. We have about 60 tremendously talented team members that work within this service organization for doctors. And it's broken out into two domains. The first domain is with regards to physician service, and I'll give you some examples about that to unpack that a bit. But the second domain is shared services for ambulatory operations specifically. So, just starting on physician services, it's things that include our medical group communications plan, how we communicate to our doctors and message to them and engage them and inform them. Also, making sure that's always a push and a pull and collecting information and insights from our physicians. My group oversees health and wellness services for doctors. That's an incredible and important piece of what we do. Earlier on, when I first started at Northwell, we also launched the first Enterprise Physician Recognition and Awards program. So we run that year over year. We call it an awards season, and it's creating a culture of recognition for our doctors that is truly special. And we also have several physician events. We actually coined these events the Doctor's Lounge, akin to the Hospital Doctor's Lounge, and it brings together hundreds and hundreds of doctors per region. We actually have one this evening that I'm going to, but we call that culture and connection. In addition, inside of physician services, we administer our medical group governance program. So we're very unique. Our medical group practice has its own governing body, formalized through a governance policy. And what this does, it establishes 10 committees offering physicians the opportunity to become pretty involved in our work. We have hundreds of doctors actually have opted in and working very closely with us on the administrative side and things like marketing communications of our medical practice, all the way through strategy, physician well-being, and finance.
That is awesome. Well, very expansive role there with that, and that's just that kind of covers that first domain as well, right? Which is uh, kind of how is that separated on the teams? Do the all 60 people work on both kind of domains, or is there different teams split off?
That's a very good question. So of that 60, actually the largest portion of those team members are a part of our ambulatory quality, which is a great segue into that second domain that I was describing. So within the group, the second piece, what we call is shared services for ambulatory operations. And more specifically, we have a referral management portfolio of work, practice optimization, looking at practice workflows for medical practice. We have EHR transformation, ambulatory quality, and ambulatory nursing. So among that 60, we have the largest portion is our quality team for ambulatory, made up of primarily nurses that are doing performance improvement and quality management across that 780 practices. And then my team also, there's about 10 very skilled portfolio and program managers that are paired and organized across the other domains that I've described. So all together, we're supporting really a pretty robust agenda, serving our doctors for the group. Also our leadership composition that oversees this. So I report into our medical group executive director, but I'm also joined by several additional physician leaders in ambulatory, including an ambulatory chief medical information officer, an ambulatory chief quality officer who are also physicians, and an ambulatory deputy chief nursing officer that is a nurse. So all together, we make up sort of this physician service entity.
Sounds like a really nice team to work on. Where were you prior to starting with Northwell? What was your background that kind of enabled you to excel at where you are now?
Yeah, so I've been in my capacity now for 6 years. I absolutely love it because every year is marginally different and expansive and changing and growing. And so I joined Northwell. Prior to Northwell, I was actually at a research and academic medical center on the eastern end of Long Island, quite smaller, but still pretty large, about 630 beds, 1,400 physicians, and that's on Long Island in New York. At the time, in my previous role, I was a senior director of a project management office within something that was newly being developed, Office of Population Health at the time. So I would say 5 to 6 years ago, there was a lot going on in population health. Of course, there still is, but a lot was emerging then. And I specifically worked on a federal grant program administered through the New York State Department of Health entitled DISRIP. Many folks throughout the country may know of DISREP because it was also administered in several other states, but it's short for Delivery System Reform Incentive Payment Program. And it was an opportunity where subsidies and funding was offered by the federal government to give to build programs specifically for the Medicaid population. And my responsibility in the PMO was to administer the grant for Suffolk County, which is a very large, geographically expansive county here in New York. I contracted with partners outside of Stony Brook specifically to get this done. And we focused on several specific projects that wound up being county-wide: pediatric asthma, adult hypertension and diabetes control, transitions of care for these populations, and then community outreach. We did a ton in partnering with community-based organizations throughout the county to serve this deserving, unique patient population. So I was there about 5 years. I think along the way, I got a really nice view into what goes on outside the hospital, which I learned to appreciate a whole lot. And I also learned not to be overwhelmed with scale. And that's what brought me here to Northwell and doing all right, given this expensive footprint.
I think population health is an awesome place to kind of get your start handling that scale. As our audience knows, I started off in the population health after working in neurology for a bit, and I love population health. The projects I was able to work on there were incredible. And as you were talking about earlier, you got your PMP there during the time as well, right? And so that's something that you recommend for individuals to do, right?
Yes, it was actually before I took that role. I was where this all started really was at my local community hospital where I grew up. It was somewhere where I volunteered even through high school, and I maintained a relationship with them. When I graduated with my MHA, I had the opportunity to, I guess, become hired with my first official job at this local community hospital. And that's where I started to log my hours for PMP, project management professional certification that's administered through PMI Institute, which is actually a global organization that recognized project managers across all entities, not just healthcare. So that's where I first started. And what specifically got me thinking about project management is in my first job ever, I had the opportunity to work on the hospital's first ever deployment of an EHR. Essentially, that was 15 years ago, and the hospital was going paperless. I can't believe how far we've come in AI and our clinical and IT workflows. Just 15 years ago, hospitals didn't even have an EHR. But I worked on the Allscripts PMO that was deploying this tool across the inpatient and the emergency department. And I fell in love with project management there. And I sort of promised myself I would go for official certification. In my role in population health, I wound up leading and standing up the project management office. And even still today, I'm always leaning on my project management skill set to drive our agendas forward.
Excellent. And thank you for correcting me there. I appreciate that. It's an incredible journey that you've had. And I did not work with Allscripts personally back then, but I do remember the remnants of Allscripts pulling some of the old records out of that. So an impressive experience for you. I want to ask, because you're in this kind of vibrant area with all these different changes going on. As you were talking about, Northwell has a varied geography, right? It serves a huge amount of people. How are you able to kind of align those strategies that your organization has with the evolving needs of the population? And I'm thinking, immigration, aging, people being born, all of that changing situation in the population. How are you able to change those strategies around to fit that?
Yeah, so I think I could answer that in two prongs. I think the first that I'll mention is we're incredibly lucky at Northwell to have brilliant and talented executive leaders that really, on a day to day basis, are aligning our mission to healthcare strategies and priorities for everyone working at Northwell. They truly understand what they're specifically doing and how it's tightly related to our strategic priorities. And a few years ago, our CEO actually published a refreshed set of 10. And the ones that we think about the most here in the medical group, I'll just name a few. But the first is creating lifelong customer patient loyalty, is one. The second, enhancing performance and optimizing technology. I know I mentioned that a couple of times. The third, reimagining and redesigning care delivery. And then the fourth is advancing our culture of continuous learning and human capital investment. And there's 10, I won't name all of them, but these four we think about almost every day. Our annual priorities are lined up against these specific areas. And if you peel back the onion a little bit more in these, you'll actually find KPIs and metrics and what we're really looking to get at. And that's set by system leaders. I'll give you an example of how we kind of take this and put it into action. We are currently, as many of your viewers probably do as well, but we administer an ambulatory patient experience survey. So we're constantly listening. We receive tremendous feedback from our patients to help us think about ways to improve day to day. But that's really tied back to that creating lifelong customer patient loyalty. And through our referral management programs, we also look for ways to make it easy for patients to access our ambulatory practice environments. And we do that through data. And so we're constantly looking for ways to optimize our use of technology with our tools and our dashboards to help inform metrics that serve these priorities. So we are data driven and constantly aligning what we're doing and what we're thinking about to these strategic priorities.
That is excellent. It's nice to hear that. I like those four especially. I think that first one stands out to me. The creating a lifelong customer patient loyalty. I've heard so many stories of that have gone both ways, where they've had a single good experience and they'll continue to use a health system, and then I've also heard people say they've had a bad experience and will never use that a health system again. So that is a powerful message, and that's excellent. So I'm gonna have to look up those other 10 after we're done with this interview. That's
And
that's excellent.
you could definitely find them.
The next question I have is when it comes to these trends. So we talked about how you're adapting to the trends that are happening. You talk about those four, strategic priorities. But what trends are you seeing that you're having to adapt to?
Yeah, and I'll respond to that also with a lens of where we sit or where I sit specifically with a physician, with a mind for physician services and ambulatory care. But I think the trends at the end of the day are exciting. Like I said, I really like being in a role where every year it's different, and it really is because we react and we respond to what we're hearing and seeing. I think the two that I would point out, just simply put, the rise of ambulatory care. Obviously, you know that traditionally hospitals were the center of care, but more than ever, we're seeing this shift towards ambulatory. We're certainly feeling it with an enterprise of our size. We're seeing tremendous demand for ambulatory medical office visits across all specialties in all regions. And a tidbit, our physicians are also in demand. Northwell doctors are ranked in the 95th percentile for a likelihood to recommend the provider in our local New York metro area peer benchmark group. This is absolutely wonderful, but it also adds to the high demand for these very, very special doctors. So, in response to that, of course, we think about telehealth. We actually doing a lot of work with e-consults and looking for those alternative methods to make care accessible, specifically in ambulatory. But at a higher level, just last year, we reintroduced our ambulatory access strategy. So this was done by our SVP for Ambulatory Service Organization, and he had introduced 6 pillars of operational improvement areas and metrics, such as new patient time to appointment, experience scores for ease of scheduling, but it really does direct and support our pathway forward. To name a few of these 6 pillars that we're really targeting is phone systems, access via online booking and the customer experience, the patient experience online and accessing care, and referral management, making it easy for patients to be directed for a follow up appointment if they were to receive a referral from primary care. Now, the other trend, thinking with the hat of physician service, is the need for physician health and well-being resources. So, because of these demands, it does increase the administrative unnecessary burdens, I like to say, documentation requirements, and demanding schedules that really do contribute to drivers of stress among our physicians. And our group has played a really big role in designing and implementing strategies to reduce administrative tasks. We call this the practice environment, is what we're after, and creating efficiencies, looking at scope of practice of our non physician clinicians, and looking for ways to ease the burden with regards to the practice environment among our doctors. We're proud of this work. I think it's a trend that has influenced us to think differently, a national trend, in fact. And in 2022, our medical group received the American Medical Association Healthcare System Joy in Medicine Award. So it essentially recognizes organizations that achieve certain levels of investment in programs and interventions and services for doctors across several specific areas. And we got this in 2022. We just reapplied in 2024 to maintain this recognition, but it really does spark and help us think about our what we call road to gold. What we're going to do year over year now moving forward to continue to make sure that we look at the available resources for doctors. We tie physicians' key drivers to stress to our resources. And when we're seeing gaps, if we're feeling that a stressor, we don't have enough resources wrapped around it, we're looking for ways to promote and prioritize our program development to guide that work forward. So I think that the trends and the shifts incredibly inform how we think. And it does make our work, I think, more impactful because we have that measured reason why we're doing what we're doing.
Congratulations on those awards. And I really think it's an incredible role model what you are all doing in terms of that physician well being. It's so vital, especially under these, and as you mentioned, these increased, pressures that they're under. I want to just, skip ahead a little bit here and talk about the challenges you've faced in implementation are and how you're using this strategic thinking. That's what we're trying to encourage at the journal is this strategic thinking. How have you used that to overcome these challenges?
Yeah, I think with the scale that we have, being in an enterprise role, we're constantly there's always opportunity with regards to our reach, which requires us to think differently. We can't send an email and rely on that. Our email open rate is only X, and we want to meet our physicians where they are every day. And so I think that's one of the places where we've thought about strategic thinking, as simple as getting our group together, working more closely with our very brilliant system executives and communications to partner on alternative ways to communicate and engage our doctors for messaging, information, and even pulling back responses and ideas and ways to improve. I think my boss likes to call it 7 times 7 ways. If we have a critical message, we strategically think about filling in those 7 times. So, how are we going to get that message out 7 times? And how are we going to get that message out 7 different ways? It can't just be email. And so, what are we doing to fill those other modes of communications and channels? And some of the ways that we've done that within our medical group is established ambassador networks. I'll give you an example. Our physician health and well-being portfolio of services actually has a network tied to it of 150 physician wellness liaisons. And that is an ambassador network that are physicians who have voluntarily raised their hand that they want to be a part of promoting these resources, promoting stress first aid, and so many additional tools across the enterprise. And so these individuals are local, and we rely on them to help us spread the impact of our resources and our programs locally across the enterprise. Another tactic that we've used, and I do really like this one, it's called a change agent community. So these are also communities of change agents. It could be our EHR transformation, which is tremendous. But the change agent community are individual who also volunteer to raise their hand to be part of a change, and we invest our time in informing them, igniting them, motivating them to come along with us and understand what the change is, understand what we need them to do, and help influence their local peers. So we have a change agent community for our EHR transformation or digital transformation at Northwell, and I also have an ambassador network and change agent community for our physician recognition and awards program that really extends our reach in a major way and has helped us. And these ideas, these concepts, they come out of our forums. And I think one of the techniques that we've used to get to these ideas, I call it, I'm not the only one that calls it this, but curious questions. I think putting folks in a room and we have a certain topic, we have a certain problem, we have an opportunity, and applying curious questions has resulted in these strategies that have worked very well, and these tactics that have worked really well for us. So that's a little bit about sort of a challenge, I guess, and some of the ways that we've responded.
Excellent. It seems like you have kind of a good formula down for how you're responding to these challenges, and I think that's a big deal. I hope that our audience is gonna think about how we can kind of implement some of these different methodologies. I think that's That's great. I also wanted to ask real quick when it comes to developing these action plans that we talk about, especially in PMP. We've talked about that in Six Sigma. We learned that. What are some of the ways that you're, just real quick, I'll leave you with those kind of final questions. How are you guys developing the action plans at Northwell? What are some strategies that you've developed?
Yeah, so I think I'll go back to those curious questions because they really are the seeds for a lot of the action plan content and development. If I were to break it down into some logical buckets for folks listening in here, I think we like to challenge the status quo. So we're thinking about why has this always been done this way and what's a better way to do it? What if the opposite were true? Who benefits from the current system and how do we bring them in to help us inform and challenge again the status quo. So that's would be the first part to think about. The second is unforeseen angles. We are such a matrixed organization that if we don't do our part in socializing an opportunity across teams and going back to those brilliant subject matter experts, pulling them in to allow us to figure out a way to solve things together, it helps avoid these unforeseen angles. And so we really tried to take an inclusive approach to action planning. We also explore underlying causes. There's always a reason why we're getting X results, we're getting X feedback, or we want to get to a certain place and we need to figure out what are the steps to get there. So we do look at the root causes. We try to understand if it could be a symptom of a larger issue. And again, all of this is happening before we really sit down to devise a plan forward. We also do a lot with assumptions, of course, and thinking about are our assumptions valid? And so we have tools actually that allows us to document our assumptions and make sure again we're socializing them and gaining consensus before we move ahead with any assumptions about a particular problem or a particular solution to a problem. And then finally, I think because we're not building for today, we're building for tomorrow, it's incredibly important to not get hung up on current state too much. Because we want to design for the future. So when we sit down and we think about action planning or designing a program forward, and I'm doing this actually with a big CRM rollout that we're hoping to accomplish in the next year or so. But we're thinking about what are the future implications and how do we make room for accommodating that now in our plans, and what are the lessons, of course, with the interviews and qualitative feedback that we're talking to folks in, almost achieving a wish list. We like to sometimes say that the wish list goes in the parking lot, but how about the wish list stay on the table, and how will that help us with planning for the future and accommodating the future? So all of that goes into kind of establishing the plan forward. I think we, achieve this through brainstorming. We have whiteboard sessions, it feels like almost every week across all the domains that I talked about much earlier in our conversation. Our concrete plans and steps wind up in pretty detailed project management plans, going back to the PMP hat that I also wear. Resource allocation, ownership, and accountability in actions, making sure not to stop asking those curious questions along the way because we're constantly changing and iterating as we move forward, and then embrace the change because it's inevitable. So if you're designing an action plan and you're halfway down the road and you learn something new, being adaptable to that change because you do want it to help inform landing in a spot at the end of the project where, again, it's positioned well for sustainment.
Wonderful advice. And I really do appreciate you going in depth on that and sharing some of these trade secrets of how Northwell's been so successful with our audience. And thank you so much for taking your lunch hour today, really sharing it with me and coming on to the episode here. So I couldn't be more appreciative, and hopefully we can have you on again in the future.
Yes, absolutely. Thank you so much.